Hello, I'm Martin McConnell. I'm the Public Information Officer for Ascension Parish Government, and we are here today to bring this special message to you about the coronavirus that has been going around the world. The COVID-19 disease is out there, and we have joining us today our coroner and family medicine practitioner, Dr. John Fresh, and we have the Chief Medical Officer of St. Elizabeth, now Our Lady of the Lake Ascension Hospital, and Chief Medical Officer and Administrator, Dr. Chris Trevino. Thank you, gentlemen, both for being here and for providing the information that we're going to be imparting to everybody about how to deal with COVID-19. And we've just left a briefing with all of the parish leaders, and now we really want to share that information with everybody. Dr. Trevino, you were talking about the best way for people to prevent the spread of the disease, or what to do. What are some of the things that people need to know?
Yeah, I mean, this is a virus that it's pretty easy to spread. It's through coughing and sneezing to some degree. Also, we can spread it by contacting with our hands. But mostly it's because we've sneezed or we've coughed and we have the germs on our hands, and then we touch things and we touch each other. And so everything that we can do that restricts the amount of time that we spend around each other, particularly for those who are sick or for those that are susceptible for getting sick, like the elderly, the more that we can isolate from each other, I think the better off that we will be at slowing this disease down and being able to better prepare for should you have it. So,
like with everything, the best defense is a good offense. So people should be trying to practice prevention and avoid getting it in the first place. But if someone suspects, Dr. Fresh, that they may have this disease, I mean, what are some of the things we need to be looking for?
Well, I think if someone has cough and fever, we want to make sure that they're not someone who may have COVID-19. Unfortunately, we still have lots of other respiratory illnesses ongoing in our communities. Influenza we still see every day. So if you have cough, congestion, and fever may be greater than 100.1 degrees, contact your healthcare provider. We're not asking everyone to come in our offices right now. Many of the practices in our greater Baton Rouge community, including Ascension, can have video visits or phone calls with their providers, because if this does not seem to be COVID, we may not want you, to be out there with the flu or other illnesses. If we think it's influenza, we'll test for flu. If the flu test is negative, those are the people who may be a little more concerned could have COVID-19. At the moment, it's really difficult to get tested. The testing procedures have been through the state of Louisiana, Department of Health. We've had to get approval. It has to be someone at high risk, someone who's either traveled to areas that have high COVID populations density of cases, someone who's cared for a COVID patient, or someone that may have another high risk opportunity to have contracted the disease. So that testing is supposed to ease up. There's going to be a centralized testing center open in Baton Rouge sometime, hopefully late Monday, and we will be able to send patients with a doctor's order for testing there. We don't want, at the moment, everyone to get tested because there's just not enough testing material. We really want to test the people at most risk at this point in time.
So if you have traveled to an area that where there have been cases diagnosed, Orleans Parish, for instance, I think as of this moment they have 36 presumptive cases. So those are the people.
Well, if you've had a contact with someone who's infected from Orleans, that would be someone we certainly would want to probably test. If you've just been around the state, even though the parish has a case, I'm not sure we'd ordinarily test you without symptoms. We're fortunate in the Baton Rouge area. As of this morning, there's no case in Ascension, no case in East Baton Rouge that we're currently aware of.
Right, it's 11:30 a.m. on Saturday, March the 14th, and as of this moment, there are no cases in Ascension Parish of COVID-19.
That we're aware of.
That we are aware of, yeah. And I guess the important thing that we want to get out there is let's not overwhelm the medical system right now. I mean, you're prepared to help people, but we don't want to cause a panic. We want to let you do your jobs because there are still other illnesses out there.
Yeah, I mean, I liken this, to make it make sense, I liken it to if you wanted to go to dinner and you showed up with a party of 5. The restaurant doesn't have any trouble in managing and being able to serve a party of 5. If you change that to a party of 20, they may need a little more time to prepare for a party of 20. If you showed up with a party of 200, despite the fact that they can serve you and know how to serve you and are able to prepare the food, they simply can't serve 200 people at one time. And so all the steps that we're talking about, isolating and protecting yourselves, are simply about trying not to hit the healthcare environment with such a large number at which we can't serve all those folks. And then in there is risk, because at the same time there's someone who's having a heart attack or someone who needs a time-sensitive illness or has a time-sensitive illness and needs treatment quickly. We need to be able to make sure that we're able to respond to the community at all times. So that's really what we're looking at, trying to do with this virus at this time, is just really trying to slow it down and make sure that we are able to manage the ebb and flow, if you will, of what's starting to happen.
Now, we don't want to minimize the danger or minimize the risk, but if you are a healthy adult, if you are a healthy a person and you're exercising precautions, even if you catch this disease, for many people it won't be that severe.
That's correct.
What we've learned thus far from the countries where this disease has been more prevalent is that they're saying at least 80% of the population has minimal disease. What you really have to worry about, if you're one of the population that has minimal disease, is spreading this to someone who may be much more at risk. We know the elderly have immune systems that aren't as responsive. We know that people have chronic diseases, lung disease, diabetes, heart disease, people who are on immune therapy or immunosuppressive therapy for cancers or other diseases, certainly are the population we're trying to prevent this from spreading to, because they're more likely to have significant disease requiring hospitalization, requiring maybe even ventilation.
Yeah. So the message to people is, it's not about you, it's about some of the people that you could possibly spread this disease to.
It's about all of us.
It's all, yeah. And I think an important take-home, I think a very important take-home is, we're going to be fine. I didn't say it wasn't going to be difficult, but we're going to get through all this. We just have to hang in there. We have to make sure that we don't inundate our healthcare services to the degree that we can, which is why we're asking for this isolation, so that the healthcare machinery and the healthcare industry can keep up, still provide the service for COVID patients as well as everyone else. Over time, our population will learn how to fight this disease, both in terms of vaccines and treatment and immunization, because as we get it, we then develop immunity in the same way they develop immunity to the flu. We'll be okay. It's going to take some time. We've got to hang in there. There's going to be risk to some folks. There's going to be other folks that get sick, although they're going to be fine, just as the flu. There's going to be some economic impact because we are not used to isolating and not doing the normal commerce things that we always do, but because of the risk of spreading of this virus, we're being asked not to do that, so there's economic downside. So there's lots of downside to what's going on, but we'll be fine. We'll get through it, and then on the tail end of this, we'll be better off for it.
And remember, it's the same precautions we'd give for any type of respiratory illness. Wash your hands, cover your cough, clean commonly used surfaces, and try to keep a distance from other individuals if possible.
And washing the hands, soap and water is the best.
Soap and water.
Yeah,
20 seconds, soap and water.
Yep.
People are buying up all of the hand sanitizers, and that's a good second option if you don't have access to soap and water. But soap and water is the best. Sneeze into your elbow, wipe down surfaces, doorknobs, and things like that on a regular basis.
And try to avoid really large gatherings.
Yep.
So hopefully in a couple of weeks, we're encouraging people, if you feel like you may be at risk, or you have issues, or you may have come into contact, to self-quarantine, choose to stay home, do not go out.
Yeah, and certainly for folks who feel like they've become very ill, very high fever, short of breath, that they feel they've taken a turn, we are prepared for them, and we are more than ready and happy to treat them and to seek, for them to seek care. Our Lady Lake Ascension, St. Elizabeth Hospital is a job. It's our commitment to our communities to always be available for all conditions at all times. And fortunately, we have a very, very robust healthcare system in Baton Rouge. Certainly we are directly connected to Our Lady of the Lake, which is a large tertiary referral center. But the other hospitals in the community, we're very lucky to have high expertise both in infectious disease and critical care, that should any of the citizens within our parish need health care, we are available and we are connected into the Baton Rouge market, that we can certainly make sure that their care is being provided.
And the systems are working together. We've been meeting with Our Lady of the Lake, Baton Rouge General, Ochsner Healthcare, Baton Rouge Clinic, and the outlying hospitals, as well as a number of the urgent care centers, to try to work together cooperatively to provide the appropriate care for the citizens of our populace.
So people just need to know that your leaders, your medical leaders are working together to take care of this. So we encourage you, don't panic, be safe, be smart.
There will be more public information coming out, how to access care next week through the different systems, and there'll be more testing opportunities over the next several days available.
This is all happening just so quickly, so fast that we cannot be, it's hard to be proactive, we're just being reactive. We do know that the state of Louisiana Department of Hospitals has a phone number, 211, that people can call 211 to get information. You can also text, I think, to 888-211. Centers for Disease Control and Prevention has a website, and there's lots of information that you can get there.
And to let everyone know that the insurance companies, Medicare, Medicaid, the state and federal government have really taken many obstacles away for care in this circumstance, that care will be covered. Medicare will allow video visits now. So I think that everyone realizes that this is a public health matter that we all need to be very aggressive about, so that we can say we responded appropriately.
Gentlemen, thank you. Thank you very much for this information. Thank you for everything that you've been doing.
Sure.
We encourage you to continue watching Ascension 21. Check the Ascension Parish website or the Ascension Facebook page, and just get information. Educate yourselves as well as you can, and just be smart and be safe.